Ear infections are among the most overlooked health conditions, yet they can lead to serious complications, including hearing loss. Experts say that 60% of hearing loss among children is caused by infections that could be preventable and treatable. Now, here's that report.
Ear infections remain a silent but common health challenge affecting both adults and children, specialists classifying them based on the parts of the ear involved. That is, the outer, middle, or inner, each presenting with distinct symptoms and risks.
It tends to culture bacteria or fungus and it becomes an infection. So that we call otitis externa. It's basically infection of the outer part of the ear. So anywhere along this skin. It presents with pain, maybe pain after swimming, pain after going to the barber shop, pain after going to the salon, and then they also have discharge, and you feel like your ear is full or swollen, and it also feels what you can call like there's something ringing, or sometimes you can have a ringing or a sound that makes it feel like there's a lot of pressure in your ear.
Outer ear infections, also known as otitis externa, are generally treatable with ear drops. Middle ear infections, frequently seen in children due to shorter eustachian tubes, usually require antibiotics and sometimes surgical repair if the eardrum is ruptured.
Fortunately, it's covered by bone, so it's quite hard for bacteria and infections to get in. However, when it comes, it comes when patients have other systemic infections, or you have other conditions that predispose you to getting those infections. And mostly it comes after a flu, because the infection will have come through the nose and then it finds its way into the inner ear. It will present with mainly hearing loss. So you can wake up and have sudden, you realize that you have a sudden change in your hearing. And then sometimes you can have dizziness, because this inner part of the ear, this one part is for hearing, the second part is for balance. So when there is an infection there, patients also present with some dizziness and or with a hearing loss that usually comes suddenly. The dizziness is usually accompanied with the vomiting. It does not rest. It usually you feel like the world is spinning. It is continuously. You're vomiting. You have a flu. You're very sick, and it can take up to 2 to 3 days before anything changes or any of those symptoms changes.
Unlike the outer and middle ear, infections of the inner ear often demand stronger treatment or intravenous antibiotics. If left untreated, permanent damage may occur, with cochlear implants being the only solution within 2 weeks before scarring sets in.
That is to say, when a child gets an ear infection and it is not treated, it can progress to become chronic. And when it is chronic, you just see that child with pus. They never cry, they never complain. They just have pus in their ears. Now those are the children who, because it's not painful, if they're left unattended, then they later on develop a hearing loss. That is for children. But again, we said adults, it's rare. So we don't generalize when it comes to the adults. But the message is that 60% of hearing loss in children is reversible, and it is because it is from infections. What we do is for these patients, after treatment, as soon as possible, we ask for them to get a cochlear implant. A cochlear implant is an electrode. It's an electronic wire, what we call a wire, that is inserted inside their inner ear so that it can stimulate. It collects sound outside, it stimulates inside, and it stimulates the nerves using that message. That is done in 2 weeks. The longer you stay, when you have an infection, you heal. And when you heal, you scar. And the scar is very tough. So that scar makes it very tough for that kind of surgery to be done. But that is what you do for those patients, and it helps them to restore their hearing.
Globally, hearing loss affects millions, and the World Health Organization estimates that 60% of childhood cases are preventable, mainly linked to untreated infections.
We should take care of our ears. Most of the times the ears do not pain, and patients often find themselves only thinking about their ears when they have a problem. So you should know that you don't need to clean your ears. You shouldn't put earbuds, because earbuds increase your chances of getting infection of the external ear canal, that is otitis externa, and they also increase your chances of getting impacted wax. The ear is a naturally self-cleaning organ. In order to take care of your ear, if you notice any sound in your ear that is not physically present, then I'd advise you see an ear doctor, because ringing of the ears, which we call tinnitus, is a sign that there could be a problem, and sometimes that is the only symptom that you will get.
Doctors emphasize that ear infections should never be ignored. Regular checkups, timely treatment, and awareness of symptoms can protect against one of the most prevalent causes of hearing loss. Yvonne Kemuma, KUTV.